Hi, moms. I'm really excited about today's guest speaker. She's going to talk to you about pelvic pain, what it is, why you get it, and what you can do about it. So you can take it away.
Hi everyone, my name is Michelle Campbell. I am a pelvic floor physio. I'm based out of West Kelowna in British Columbia here. I work in clinic and I see a wide variety of kind of normal physio stuff with pelvic floor patients. And I also have a little online thing that I do too for pelvic floor physio. So yeah, it's kind of me in a nutshell. Yes, thank you, Hannah, for having me. Really appreciate it. This is a fun little connection. We wanted to talk about what we call pregnancy-related pelvic girdle pain, or just more simply pelvic pain. So basically it's pain that of course comes on as you're pregnant, and it can be anywhere in our pelvic region. So it can be more bony, we can feel it more kind of at our ligaments, and often it is our muscles, our pelvic floor muscles as well, that are a large cause of it. It can present very differently in every woman essentially who's pregnant, just due to individual differences. But a lot of common things are we can get kind of pubic bone pain, heaviness, a lot of pain kind of at our low back and sacrum and SI joint regions. So I have a little model that I can just kind of quickly show you. But basically, it can be anything from the front. So our pubic bone is here, can go all the way around our pelvic bones and then into our back. And this is kind of our SI joint region, our sacrum, and then up into our lumbar spine. So we can have pain anywhere in those regions. So it's a bit of an all-encompassing term. Yeah.
Okay, so what is pelvic girdle pain exactly?
Yeah, so that it's kind of the same as just saying pelvic pain. So our pelvic girdle is essentially this whole kind of region, everything. So including bones, muscles, ligaments, tendons, everything in the area can just be kind of generally said as pelvic girdle, because our girdle is our just pelvis kind of holding everything up on top of it, all of our organs, baby, everything else there.
Okay,
Yeah.
perfect. So
Yeah.
what about lightning crotch? What is lightning
Yeah.
crotch?
Yes, that sounds like a fun one. I have not had kids myself, but had many women explain it. Does not sound very pleasant whatsoever. But that's where we can get these kind of sharp shooting pains anywhere through our kind of pelvic region. Some women explain it coming down into their vulvar area. Some people feel it kind of more internally and up in through their vagina. And some people feel it more externally down through kind of groin area. But essentially, we get nerve compression, which then shoots these pains down, and we get this lightning feeling. But it is nerve related, so it's nerve compression due to either baby getting bigger and compressing on some of our nerves through our pelvic floor muscles. That's kind of generally the reason, just compression due to baby getting bigger as time goes on during your pregnancy.
And what can moms do if they have it?
Yeah, so while it's happening, and again, varies with women for how long it'll kind of last for at a time. But we can do certain stretches, we can do certain movements. A big thing is using our diaphragmatic breathing to help kind of settle it down. And looking for patterns. If there's certain patterns that you get with it, so if it's say it comes on every time you walk or every time you do a certain exercise, then we want to kind of modify it and see what we can change to avoid that from continuing to happen.
So what about if someone wants to do lunges in their pregnancy?
Right.
Is that
Yeah.
okay?
And you know what? That's just kind of generally there's no, issue with lunges as a whole, unless again it's bringing on this pain that we're trying to avoid. But if you're someone who, say, prior to pregnancy hadn't ever done lunges before, and then we decided to start it, then that could be something where we want to modify or start really slow and maybe not a full lunge. But generally, the kind of general rule of thumb with exercise is, if you've done it well before pregnancy, during first and even into whatever trimester you happen to be in, then you're quite safe. So they're not a no-go by any means. It's just depending on the person and what their body is used to and what type of load they're used to.
Perfect. That's great.
Yeah. Yeah.
What about if you get women who experience any cramping? What can they do?
Yeah.
Like, why do you get cramping during pregnancy? Should they be worried? What can they do about it?
Right. Yes. Great question, and often one that we hear of as well happening in quite a few women. And yeah, and so kind of like you alluded to earlier, some women, describe it as feeling like they're having menstrual cramps, that kind of stuff. And what happens just with baby and our pelvic floor, there's just so much pressure in through our muscles here that it can kind of almost start to replicate or duplicate that feeling of period cramps. We just have a hugely increase in fluid, as I'm sure every pregnant woman knows. We get lots of swelling, all that kind of stuff, and the same goes for our pelvic floor and pelvic region. So that can sometimes mimic that feeling of cramping, which when we have our period, we do have that increase in fluid as well. So yeah, again, it shouldn't be something that's super crazy long standing in your pregnancy, but if it happens here and there, totally normal. It can also be position of baby, however they are within the pelvic kind of region. And baby could be pressing on something that's uncomfortable, causing a cramping feeling, but totally normal and not something to be worried about.
Perfect. Is
Yeah.
there anything else you want to say about why there's pelvic pain and what moms can do about it who are experiencing it right now?
Yes, no, these are all really great questions. Yeah, so it's very interesting. I think most of us have heard about the hormone that gets released when we're pregnant called relaxin. So relaxin is a hormone that essentially goes and hits our ligaments. So we've got ligaments that connect bone to bone, kind of on the front on our pubic bone here, and a ton of them that kind of hit on the back. So kind of historically and traditionally, we've always thought that the reason why women get an increase in pelvic girdle pain is because relaxin gets released during pregnancy and our ligaments become looser, and then that can cause a bit of shifting and then discomfort as our body and pelvic girdle or pelvis in general are making way for baby. But super fascinating, all the new research that's coming out is actually showing that that's debunked now, which is really cool because that's something that we've all been telling people for forever. But they're finding now that pain is less of this kind of black and white, what we'd call in physio like an orthopedic issue. So we're often looking at, yeah, again, bones, ligaments, tendons, muscles, and we're trying to find what the issue is and then we're trying to fix that. But they're finding in pregnancy that pain like that is actually more attributed to kind of other variables in life. So are women getting enough sleep? Which, if you're pregnant and have other kids, I'm sure the answer is no. But do you have a good support system? Are you exercising enough? Are you getting outside? Kind of more of what we call the biopsychosocial model. So just looking at these other factors in women's lives where we can kind of work on those things to actually help decrease pain, which I know kind of sounds a bit out there, but it's very science backed. And having said that too, we can also do certain exercises to strengthen, to stretch, to make sure everything's in kind of really good condition to hold baby. Because at the same time, everything is moving and shifting as it needs to for the baby, but it's less of that, again, that relaxin hormone and more of all these other factors, while making sure exercise is still a part of a woman's kind of daily schedule. So yeah.
Perfect. Is there an
Yeah.
exercise example you can give? Like right now, if I was a mom with, let's say I had pelvic pain, is there an
Mhm.
exercise you could give me like right now to do that you would give a
Yeah.
client?
Yeah, and you know what? Coming from yourself as a yoga teacher, again, one of the best things we can do is actually use our diaphragm to breathe. So our diaphragm and our pelvic floor actually work as a piston together. So when we're doing our nice deep belly breath in on our inhale and our stomach is coming out, our pelvic floor muscles are actually coming down with our diaphragm. So they're kind of doing this. They're working together. It's kind of hard to picture. But on the exhale, then our stomach is coming in, our diaphragm is coming back up, and our pelvic floor is coming up with it as well. So we get this piston effect. So I often give women, we call it a reverse Kegel, or just kind of including a Kegel in with our diaphragmatic breathing. So that looks like us taking our nice deep belly breath in. So imagining all of our air is going into our stomach on the inhale. At the same time, imagining that all of our pelvic floor muscles are nice and long and relaxed. And then on the exhale, stomach comes down and we gently pull up and we do our Kegel. So what that does is it activates and then relaxes our pelvic floor muscles, but also at the same time, we're actually decreasing our stress response as well, which is really fascinating. So we're kind of bringing our nervous system down from our lovely fight and flight mode to more of that rest and digest. So that can actually really help with pain. So it goes back to breathing, which I know, again, yoga teachers, you guys talk about it a lot. A lot of birthing classes talk about it, but it's super, super crucial in so many things with pelvic pain. So that would be kind of
Perfect.
the number one thing. Yeah.
And if any moms watching this want to book a pelvic floor session with you during their pregnancy and even postpartum,
Yeah.
where can they find you? How can they book you online?
Yeah, so I have a website and it's Michelle Campbell physiotherapy.ca. And you can go in there and book. It's super easy. It's through the Jane app. If anyone has used that before at other clinics, it's super user friendly. I've got a bunch of times open on there, but if something didn't work, then definitely please message me and let me know, and we'll find a time that works. But yeah, easiest is probably to go through my website, but I'm also on social media, just Michelle Campbell Physio on Instagram. And then I've got all the links on there as well.
Perfect. Thank you
Yeah.
so much for joining us and
Yeah.
explaining all about that, because it's so common in pregnancy. And I feel like women suffer through it instead of
Yeah. Yeah.
understanding it and getting help.
Yeah. Well, thank you so much for having me. I really appreciate it. That was awesome.